Selvaraj.
Respected sir, I thank you very much for allowing me to speak on an important subject concerning the patients who are suffering from mental disorders. The bill was originally introduced in the August House on 19/8/2013, and the same was referred to the Standing Committee on Health and Family Welfare on 28/2013 for examinations and report within 3 months. The committee submitted its report within the time period. I am happy that the bill has been taken up now for consideration and passing. Now I would like to put forward some of my views and suggestions on this bill. Sir, the government of Tamil Nadu, under the leadership of Honorable Chief Minister Dr. Puratchi Amma, had set up a state mental health authority, Tamil Nadu, way back in 1994. Probably the Tamil Nadu was the first state for setting up the such an authority to reduce the burden of mental illness and behavioral disorders to a person, their families and caretakers, and the authority was mandated to regulate, develop and coordinate mental health services and to deal with all matters which under the Mental Health Act. Today, under the dynamic leadership of our Honorable Chief Minister, Dr. Puratchi Amma, the state in the forefront as far as steps towards mental health are concerned. Tamil Nadu is the only state that has at least one psychiatrist in each district, something with compared to other states. In spite of having taken many steps, the number of psychiatrists in the country still does not exceed 4,000, and there is a great need to add on the number of psychiatrists. And there is a need to increase the institutes as well as the courses at the level of post-graduation in the medical colleges. There is just one psychiatrist for 4 lakh Indians, and that 80% of our districts do not have even one psychiatrist in public service. India devotes less than 1% of the health budget to mental health compared to 10%, 12%, 18% in other countries. I know, ironically, it is in urban areas where medication and psychiatrists are available, but in rural area, medication is not available, nor are psychiatrists. The preliminary health centers does not stock medication, and huge population of the people with major mental illness do not have access to either treatment or to medication. Must government hospitals have allocated their worst wards with the lowest beds, fewest bed to mental illness ward in the most neglected area, even near the mortuary, and this is the determination as the mentally sick people determined in employment and its society. Sir, at least 5% of our population lives with a mental illness, which accounts to over 50 million people. These numbers have a close bearing with the rate of suicides, and that nearly half of these with severe mental diseases are not treated, and of those with less severe versions, nearly 9 in 10 go upward or far. About 1 in 5 people in the country need counseling, either psychological or psychiatric. Depression, the most prevalent form of mental illness, is estimated to exist in 3 of every 100 in urban areas like Mumbai, extra, and of these 1 in 3 are severely neurotic. Thus, India without a massive mental health movement will set a lot of homeless, destitute patients. The burden of mental illness will increase more rapidly in India than over the next 10 years. In India, only about 1 in 10 people with mental health disorders and taught to receive evidence-based treatment. By 2025 in India, 38.1 million people whose life will be lost to mental illness, which will be an increase of 23% compared to the previous figures. The mentally ill patients are also discriminated in giving insurance facilities to them. The insurance companies do not provide medical insurance to the people who are admitted in hospital with mental illnesses. Admission to a good hospital is out of reach for some because of this. It is sad that the patient in an ICU is billed a few lakhs, but there is no insurance just because it is a mental illness. This we need to look into it urgently, and the class 20 and 2 of the bill be made tough by suitable amending it. Generally, people desire that medical treatment should always be a secret and to be disclosed only to near and dear and the doctor. However, the clause 23(2) in the bill deals with the right of the secrecy in the respect of person with mental illness. Any ambiguity in the clause will defeat the purpose of this clause to keep all the information confidential which has been obtained during the care of or treatment by health professional providing care or treatment to the person with mental illness. Therefore, to keep up the secrecy, which important clause should be carefully framed with class intentions so as to avoid conflict and confusion at the implementation stage. It is well settled and generally accepted norms that only the professional in the relevant field can come up with valid suggestion and solution to the field related or relevant to him or her. The Class 80 provides for setting up on a mental health review board and the Class 81 provision for composition of the board. Therefore, both the members of the mental health review board proposed under the above class should be psychiatric. As a psychiatric, being a specialist is better equipped to protect the interest of the patient. The standing committee on its report on the proposed bill has suggested many things which can be incorporated and implemented so that the country can take care of growing number of mentally ill health patients. With this, I conclude and support this bill. Thank you, sir.